और ओमिक्रॉन के बढ़ते मामलों के बीच देश में टीके की बूस्टर डोज को लेकर भी बहस छिड़ गई है। इस मुद्दे पर देश के कई जाने माने डॉक्टरों ने अपनी राय रखी है।
We are on the doorsteps of a very difficult time, which is likely or unlikely, we are not yet sure. Europe is under shaking chills as well as shaking with COVID. We in India are still wondering whether or not we are going to get into the same scenario or not that we had in May, June, July last year. Right now, the scenario is different in the fact that we have got a weapon in hand which evidence says can give us significant amount of protection, and that's booster.
Third dose is helpful to boost up our immunity, but in Indian perspective, third dose can be given for a high risk people who are the frontline warriors, elderly people having multiple comorbidities irrespective of the age.
The emergence of the new Omicron variant further emphasizes the importance of vaccines, boosters and other preventive measures to protect against COVID-19 infection. Early data from South Africa suggests that the Omicron variant is increasingly transmissible and has the potential for immune evasion. So this is the right time in India for us to have the COVID-19 booster shot, especially the healthcare workers, the frontline workers and the vulnerable population.
So this is the best time when there is no massive rise in COVID, there is no epidemic, and you can get your shot safely.
It's recommended for people who are above 65 years and who are the frontline workers, an aged population with 50 years with comorbid conditions, whose antibody levels tend to wane off from duration of around second dose. So it would be better if they get the booster shot to improve the immunity titers of the body.
In all of them, the efficacy begins to wear off anywhere from 6 months to a year. It is therefore important that booster doses be given to those who are eligible for them, particularly our frontline care workers and immunocompromised patients.
तो जैसे ही आपकी इम्यूनिटी कम हो जाती है तो बूस्टर डोसेस लेना जरूरी होता है हर वायरल इलनेस के खिलाफ। तो वैसे ही कोविड-19 के खिलाफ भी हमको बूस्टर डोज जरूरी है। दूसरा कारण क्यों ये जरूरी है तो वो है खास करके उन पेशेंट्स के लिए जिनकी रोग प्रतिकारक शक्ति कम होती है, जैसे कि कैंसर के पेशेंट्स जो कंटिन्यूअसली उस दवाइयों पे होते हैं जो उनकी रोग प्रतिकारक शक्ति को कम करते हैं।
बूस्टर डोज or third dose for the COVID vaccine is necessary, at least for this population which is vulnerable, and that population is the one who have got immunocompromised states like cancer, maybe transplant, dialysis. They may not have mounted enough response with their immune system with the 2 doses of vaccine, and they certainly need a third dose to be given now.
I would still wait for more data and evidences, but might start in a small subgroup of immunocompromised and frontline workers who are at extreme high risk and development of COVID-related gross morbidity and mortality.
Till now, these booster doses are not backed by clinical data, but frankly speaking, the patients who are frontline workers and elderly patients with comorbidities should be recommended with booster doses. Especially those patients in which the immune response is not there after 2 doses of vaccines, especially in the form of antibodies.
Booster dose, still we don't know how effective it would be, whether it is necessary or not. But yes, what has been found that booster dose does not do any harm. Now, like in the case of any other viral infection, like a flu infection like we usually take, there is a booster dose that we take every year. Similarly, since COVID also mutates frequently, new mutations form, so we may need to take a booster dose when the antibody levels or antibody titers keep waning.
The evidence for a third dose or a booster is so far quite unconvincing. What we know for sure is the fact that the second dose vaccination protects us from severe disease even in the case of Omicron. So, in my opinion, it is extremely urgent that we accelerate the current speed of vaccination, vaccinate as many people as possible with the second dose.
Before we actually go on to, recommend that third dose of booster should be given to patients with COVID who have taken, or or people who have already taken 2 doses of COVID vaccine, we need to make sure that everybody who are there in our country are already vaccinated with 2 doses of vaccine, because unless that is over, we can't think about third dose, which is a booster dose.